Hello viewers, welcome to the Mapu 24/7. This is our reporter Wangje Konyak reporting from Capital Convention Center, Kohima. Viewers, Amikhan Janole parents na Ayushman Bharat, PM-JAY and CMHIS to issue collect health insurance scheme ase to hospital de chola laga patients kan judi treatment ni media aha umoi payment kan diadam de to schemes related pra help kra laga ekta scheme ase. To amikhan janole parents na to especially CMHIS laga opor bishi charcha ola laga amian itu honole parshi bishi misunderstanding to schemes laga related. To aji itu kan laga opor highlight kurli nimite ekta one day media sensitization program rakishe on Ayushman Bharat PM-JAY and CMHIS itu ile Nagaland Health Protection Society Department of Health and Family Welfare Nagaland khan pra rakishe aro aji ite seminar rakha homoi various issues laga oporte related to CMHIS laga oporte takan highlight kurshi aro last month July de huilibi CMHIS related issue olaishe kote itu scheme laga oporde hospital khan bra bal bra sensitize no kranai kugene itu laga oporde bi media de charcha olaise tu itu khan laga opor ite department khan bra kwado issue kule judi itu related problems kan ahishi kule do media khan ge highlight nukri ge na hoishi kule ta khan ge ite ekbar toll free number bi ekbar moi screen de dekhai dibo itu toll free number de hoishi kule dial kuri ge na ta khan laga grievances ta khan laga problems to itu number ge ta khan ge share kuri bi ku ge na itu kushe kwa humoi ta khan itu kushe ki hospitals kan kondu hospitals to impanel kurigina ase both the schemes kondu hospital to scheme cholai na cholai check rule ni mede hushukle CMHIs laga website khande jaigina check ra pare kugina to go share sub related bimar khando under both the schemes to cover kurigina to highlight kurse aro aji ete seminar rakha homoi ekta ta khan media lo de rakinia collaborate kurigina future de hulibi grassroots level de bosti de jaigina itu scheme laga opor ta khan ge educate ta khan ge samjai dole ni mede itu khan laga plans laga opor debi takan aji seminar law homoi takan itu updates krishe to IB details aji laga seminar kina aji shi amen ekbar video de sailu
PM-JAY and CMHIS. The theme of today's program is enhancing media awareness and public outreach on AB-PMJAY and CMHIS. We are grateful for your presence and look forward to an engaging and informative interaction throughout the day. The media plays an important role in taking information on public welfare programs to the people. Today's sensitization program is an opportunity to strengthen our collective understanding on AB-PMJAY and CMHIS, clarify key aspects of the scheme, and encourage accurate and responsible public communication. A brief introduction from my side. I am Dr. Imlina Longchar, Monitoring and Evaluation Manager, NHPS. I will be chairing and moderating today's program, and it is my pleasure to be with you throughout the day. I look forward for an active participation and engagement in the sessions ahead. With that, let us begin today's program. To deliver the welcome address, it is my privilege to invite Sri Tavasalan KIS, CEO NHPS. Sir, may I request you to kindly address the gathering.
The purpose of today's meeting is to deepen our collective understanding of the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana and the Chief Minister's Health Insurance Scheme. So the Nagaland Health Protection Society essentially runs these two schemes. The AB-PMJAY, as you're aware, is a central scheme. The state also contributes a part of the premium that goes into implementing the scheme. The Chief Minister Health Insurance Scheme, like you're aware, is one of the only two state initiatives that our state has launched, the other being the same microfinance. The Chief Minister's Health Insurance Scheme was launched in October 2022. Now, what we'd be taking you through today is what are the objectives of these schemes, how do they operate, what are the implementation processes, and what are the challenges that are being encountered in the implementation of the scheme on a daily basis. Not just from the Nagaland Health Protection Society's point of view, but from the hospital side, but in the insurance side, and what are the issues that are most importantly a beneficiaries face on a daily basis?
This is also regarding CMHI's issue, and this issue has been like widespread last month, even in many social media, where government employee alleged that newborns in ICU treatment cost about 6.79 lakh, but CMHI's EP covered only 1.63 lakh, leaving him to pay about around 5 lakh 5.15 lakh. So what is the current status about this issue?
This one, we had spoken with the hospital also and asked them to raise the claim in the system. Again, ideally, we would prefer if patients immediately let us know, because this was a case where the hospital operator, for whatever reason, did not raise the claim in the system and did not provide the service. Ideally, if the patient had called us first, we could have checked what is the issue and told the hospital to immediately raise the claim, and all this could have been avoided ideally. But they made the payment and then went out in the media. That's another thing. But this has already been cleared. We have spoken with the hospital and had them raise the issue in the claim in the system. Yeah.
I represent Dimapur 847. My question is this. In the recent past, 1-2 years ago, there have been some cases in Dimapur especially, some hospitals which display PM-JAY, Ayushman and hospitals outside reports. So seeing that many patients have gone to these hospitals, or maybe the website details which you just mentioned, people see those big billboards or banners and they get into the hospitals. But in that period, maybe for some few months, I'm not naming those hospitals had some issues maybe with the department or the government. They were unable to reimburse, including my father. My father was admitted to a private hospital and Bangalore hospital in Dimapur, but he could not get reimbursed, lakhs of rupees. Similarly, there were many cases among my friends and family, many local people which we have interviewed. Now, they did not get the reimbursement because maybe for a few months or some issues were going on. But the time has passed, they had a health card, and the hospitals were empaneled. Those same very patients, will they get the money back? Now, the time has passed, and I'm talking about lakhs and lakhs of money. Yeah, maybe they had some issue for a short duration, but it's their hard-earned money. So how they get it back now?
A year ago, and private hospitals had actually decided to move out of the scheme, even though they have come back again now. So during that period, because we did have that specific issue where they terminated the contract, we had issued a public notification also to everyone to please, these hospitals are no longer providing the services under the scheme, and to go to any of the public empaneled hospitals, including CIHS. Because if the hospital is not providing services and they have terminated the contract, there is we cannot force the hospital to provide cashless service. That is why we have issued a public notice also to please visit the government hospitals for any emergency treatment during that period.
But that I understand. But there are people now. People are poor. People are uneducated. But those hospitals were proudly displaying big banners and seeing those people get into those hospitals. Maybe they are not following some detailed notifications in the website, but they just get in and they have lost their money. Can they claim it?
I think the hospital would have said the services are not available under the scheme, right, when they went for treatment. Because generally the initiation of the coverage starts from the moment they are admitted, right?
I've talked to many people on the field. It's only after they have done the treatment the hospital tells them that.
No, in our insurance, generally the coverage, the moment you are being admitted for any treatment, the hospital has to raise a pre-authorization request to the insurance company. So before the commencement of the treatment itself, the hospital would have informed that the coverage is not provided for the scheme.
Recently, I've met with one kidney stone patient, and she was telling me about the problems that she faced. And that very hospital is also already empaneled with the both the schemes. And she was saying that despite she being treated in that very hospital, she did not, they denied the the benefits. They said that this very card cannot be used for this kidney stone treatment and even for the operation. So, can you highlight more on that?
We cover all disease, all treatment, as long as it's a hospitalized care. So we have the conservative treatment where there is no surgical intervention required there. As long as a patient is hospitalized, we cover all of that. And if there is a surgical intervention required for any surgeries, even though the patient is not hospitalized, even for minor surgeries also we cover that. There are certain daycare procedures that we cover. For example, if you are going for a dialysis or cancer radiation therapy or chemotherapy, we cover all of those. We have given our helpline number, and we are trying to popularize our helpline number as much as possible, so that if any patients they are denied any of the service in any of the empaneled hospitals, they can immediately call us at our toll-free number, so that we can, wherever possible, intervene with the hospital and ensure that their service is not denied at the hospital. So I would again request you, because unless it is made known to us, we are unable to intervene for every case. For any such cases, you can ask your friend also to call us at our toll-free number whenever she goes for treatment next, so that we can intervene why it is being denied and if there is something that is stopping the hospital from providing such services. Otherwise, we cover all kinds of diseases. There is only certain exceptions. For example, under PM-JAY, we are using the National Health Benefit Packages. Certain treatment like immunotherapy for cancer, that is covered under CMHIS for employees and pensioners as a state scheme. However, nationally, immunotherapy is not covered. So that is not available to general category or PM-JAY beneficiaries. Otherwise, most other treatment is covered. So we have listed a health benefit package, but it's not possible to exhaustively list all disease, all procedures. So we have an open procedure code called an unspecified procedure. So even if the treatment is not listed also, hospitals can book it under the unspecified package to avail the services.
Hello. As media persons are, we have this question. The previous insurance company was Future Generali, India Insurance Company, right? Which had issues. There were fraudulent cases, so to say. Even in the media, we wrote reports. We covered things were falling out, and even the Kohima High Court intervened, and directives were passed. Yes, we in the media we know, but can you, since you are the actual people representing the department, can you spell out for us in clear terms what exactly went wrong, with the Future Generali India Insurance Company, and right now it is Indus General Insurance Company, right? What are the things that were kept in mind before offering the contract the present insurance company to make sure that things like that don't happen in the future? Like, the things which we discussed earlier. Like, as journalists, we would really like to know this present insurance company, why would it not behave the same? Because when it behaves same, people suffer.
Yeah, much on that one. There is just, you can just say that there's a dispute between the hospitals saying they are not being paid and FGI saying they have made all the payments. So that's in the court, so I would not like to, because we are also party to that case. So it will be very difficult for me to comment much more in detail than that. Regarding the lessons learned from FGI, with the new tender, with the new insurance contract, we have introduced penalty clause for wrong adjudication of claims. So when we say wrong adjudication, let's say a hospital submitted a claim and the processing team rejected it wrongly. The treatment did happen and documents were submitted, but the insurance rejected the claim. That's a wrong adjudication. If the hospital submitted a claim, a fraudulent claim, where the documents were not submitted correctly and insurance still approved it and made a payment, that's also a wrong adjudication. If a hospital submitted a claim for 10,000 rupees and then the insurance company just arbitrarily deducted some claim amount and paid only 6,000, let's say. All these cases where claims, we call it adjudication. If any claim is adjudicated wrongly, be it rejections, deductions or approvals, we have introduced a penalty clause. So we, like I mentioned earlier, we have an audit team at NHPS also, who is doing sample audit of all the cases that the insurance company is doing. And even in the system also, it's inbuilt whenever an insurance company makes any deduction or rejects any claim, this gets triggered.
they have put in certain triggers, and it comes to our NHPS team for audit. And if we find out during audit that the adjudication was done incorrectly, in our new insurance contract, we have introduced penalty clauses to the insurance company, because of which they'll be penalized. Now, when we say penalty, the amount itself is one thing, but for an insurance company to be penalized by a state government is a huge thing. So those, hopefully with those penalty clauses, we would be a little more better than what we had with the FGI.
Just to on this matter that you raised, does the NHPS, Nagaland Health Protection Society, right now have like do you have like some kind of quarterly public dashboards or anything that display and tell the performance of hospitals, the claim settlement rates, so that before cases like this happen, people can have prior information. Okay, this hospital is doing better, claim settlement is on time, things don't delay. Or if not, can the NHPS, commit to something like this so that the public, general public, unaware public, they don't follow, as I said earlier, detailed guidelines in a website in a corner somewhere, but like public dashboards.
Where we have all of the information of the payouts that are happening on an annual basis, so that is publicly available. Our website is not something that needs to be logged in to see all of this data. All of this is the login fee, it is publicly accessible. Regarding your suggestion or feedback regarding hospital performance, currently we don't have something like that. We do have the data for it, but that is something we can take into consideration. This is something that perhaps we might need to also consult with the hospitals as well, whether they would be happy about something like that, because they are our implementing partners. So that is something that we can definitely consider and discuss with them as well. And if they are willing to be, put up there, I think that's something we could consider.
Yeah, we would really like to believe the hospitals would consider this, because it would be very concerned that I'm raising this question from.
Right. I get your point. So it's well taken. That is something we can definitely consider. Thank you for that.
Especially for the Naga people, why not speak in Naga so that everyone can understand? So yeah, the entire session could have done in Naga is like so many could do like any posti kind of way, without kind of way.
About sort of sensitizing the media, we want you all to understand. And a lot of the work that we do is in sort of very technical terms that we have to end up using those technical words anyway. But yes, that is a very good point. We do try and be as, to use the dialects as much as we possibly can. That is something that is noted. We will take that forward. But yes, for today's purpose, we really could not use Nagamese because Commissioner, even if we tried, we would need to go back to using, all of the words that we need to use. But I think we have also realized that, like she's also touched upon it a few minutes ago, that maybe perhaps because we use this language so routinely for us, we automatically understand. We say KPIs and we say TPA and all of that, we take it for granted that we understand, so everybody will also understand. We do understand, so we're also trying to simplify our language, at least for the part that goes out to the public, because for us, our intention is to be as clear as possible, right? We want to make sure that we do not misunderstand, but sometimes when we are trying to be so clear and technical and so small print, you lose the forest for the trees, right? You're so busy looking at these things that you forget the big picture, which is something that we have also realized. So thank you very much. We will also keep that in mind. That's very good feedback. Which media house are you from? Acha, thank you.